During my residency, I was exposed to Speed. I used some of the test series and QBanks from Speed during my preparation, which was.
So I bring in all the wishes and greetings on behalf of all the faculty members of Speed Medical Institute to Dr. Ravi Kumar for scoring a topmost rank of AML 1 and CML 1 in DM Super Speciality of Medical Gastroenterology in NESS session November 2025. Congratulations to you, Doctor.
Thank you, sir.
It's a great accomplishment, wonderful achievement, and moreover that your presence here makes a huge difference. And can we know your brief background history, what all you have done till date?
My name is Ravi Kumar, and I have done my MBBS from Maulana Azad Medical College, New Delhi. Then I did my MD in medicine from All India Institute of Medical Sciences, New Delhi. Then I did my SRship for 1 year, and then I appeared for this INASS.
Great, wonderful accomplishment. And can we know why your specialty of choice was DM Medical Gastroenterology?
So initially, I was confused between different subjects. There was no alignment towards any subject, but I gave my INA first attempt in November 2024. When I appeared for the paper, I felt that I know something about gastroenterology, and then I started reading about that. And after reading some time, I developed a liking towards this subject. So I decided afterwards that I will do this only. And more or less, I wanted to be in an interventional branch. So that was also a point towards choosing gastroenterology.
You had little liking for surgery in undergraduate days as well.
Not much. I was very predetermined that I will take MD medicine in my post graduation.
Because the minute you said intervention and probably
Yes,
it's a,
when I was in medicine, I used to I like doing procedures in patients. So that was the thing.
okay, great. So once you have decided to do a DM medical gastroenterology, and then when did you start your preparation? How did you do your preparation? What all you did to achieve this topmost rank?
So till my final year MD, I didn't thought of studying separately for DM interns. So I ended my MD medicine residency in August 2024. So till then, there was no specific subject which I was targeting for DM. After that, I joined SRship at AIMS only. So then I thought that most of my friends were appearing for DM. So I also thought that I will appear for DM. So I appeared in gastro for the first time. Then when I gave the exam, so I was qualified for the interview round in that exam. I was not prepared, but I appeared for the interview round. I felt that the subject is, I developed interest towards the subject when I started reading. Then I thought that I was not aligned towards any branch from the start, but as I started studying that subject, I developed a liking. So that was so I mainly started preparing for DM from this January 2025. So this, for 9 months around, 9 to 10 months, I've started.
What
Yes.
was your last? Can you share what was your last CML and AML rank?
So I appeared 3 times. In November, my AML was 17, and CML, I don't remember, but in again in May, my AML was 21 and CML was 17. So
This is the third one.
yes.
So, so consistently on the firing mode and now on top.
Yes, this time I focused more on the theory part, because interview you can't predict that how much marks you are going to get. It's just for few minutes you might not answer the question which was asked. So mostly I focus on theory, getting marks in the theory, so that I have a secure spot in the top 10 ranks at least to get a seat in gastroenterology.
Excellent. So, how you got introduced to speed and what was your experience with speed?
So during my residency, I was exposed to speed. So I took the medical course for preparing for, just for reading the things which is in the MD medicine whenever I get few free time. So afterwards, I just that time I just used to see the videos of the topics which we used to see cases in the ward. Afterwards, during for INA preparation, I have used my own notes which I made from Schlesinger. But I also use some of the test series and QBanks from Speed during my preparation, which was.
So was it useful for the exam?
Yes, sir. The questions were similar in the lines of the what were asked in the GT. The question were in the similar pattern in the main exam.
Okay.
It was useful.
Yeah. So, I mean, was the preparation for general medicine was on from Harrison and Harrison 22nd edition? Nothing on
Honestly,
general medicine.
I didn't read specific for general medicine. I just was because in AIMS we are exposed too much to the general medicine, so I didn't read apart from the gastro. I didn't prepare. Just I did the previous year questions for general medicine. That's all.
Okay. Can you tell us something on the paper? How many questions did you attend this paper?
So in the theory, I attempted all 80 out of 80, in which I got 74 correct and 6 wrong. So my
Excellent.
score was 72.
Excellent. Now, can you tell us something on the paper? What they are focusing? What are the important areas they are asking? So that.
So one thing I will stress on what anyone preparing for gastroenterology, so they must go through Schlesinger. So Schlesinger is the book from which they ask question, be it the tables, be it the text. So you have to study Schlesinger without just relying on Harrison. You can't go for INASs at least. So you have to study Schlesinger. There are 131 chapters in it. You cannot cover every chapter because 80 question is to be asked. So every chapter won't be coming in the exam. So you have to segregate the chapters into three zones. One is the must know chapters like IBD, like CLD. There are things which are commonly asked and they are must know for a gastroenterology practice. So that is to be mastered first. Then there are some desirable topics which you have to study after you have mastered the must know topics. And there are some chapters which are not frequently asked. So you can just see the tables and the images in these chapters. And then you can skip the text. But the must know chapters, you have to be thorough with the chapters and you must be knowing everything which can be asked from this chapter. So that was my strategy for gastroenterology. So Schlesinger was the base of my preparation.
Great. Now, can you tell us how you prepare for interview? What did they ask you in the interview? And can you share something on that?
So as I had appeared twice earlier also for interview, so I knew that there is they ask cases initially, then they show us the spotters. So I just prepared like our MD final exam that what to tell the differentials when they ask you don't jump into the diagnosis first. Also tell the what could be differential, what could be the what history you will also ask. They might be giving you history, but additional history you should also ask. You should also examine the patient before going to the imaging or diagnosis. So this was the approach I followed. Rest the spotters are not very tough. Just the important images and important instruments are asked, and the cases are also the emergency cases and the normal cases which we see in the gastroenterology. Not very atypical case they ask, but you should be thorough in that managing important emergencies like ASUC, like varicose bleed. You must be thorough about that things.
Okay, great. Now, what will be your advice for the future aspirants of DM Medical Gastro?
So I will tell them that you should focus on one source and it should be Schlesinger based. And you don't run away, run for covering each and every topic. You should segregate the topic into what is more important, what is desirable, and what you can just skip. So, and multiple revisions will make things easier because in exam you have to sit with a calm mind. Without calm mind, you can't recall each and everything which is asked. So it is a very vast subject. In gastro, you have to also read gastro and hepatology also. So it's a vast thing, but by reading multiple times and having a calm mind before the exam, will be helpful for the final exam.
Great. So time to thank, and whom all you want to thank, you can thank using the platform who helped you from day one till date to achieve whatever in your career.
So I will first like to thank my parents, my friends who have very big support during my preparation, and also the teachers of speed and everyone who have made this journey possible for me to achieve this rank.
Great. Wonderful. So very nice to hear from you. You shared all your experiences, preparation strategies, what all you're supposed to, a student has to do. And it is great and amazing. And we once again wish you all the very best and all the success for a great and wonderful career in DM Medical Gastroenterology. Best wishes to you, doctor.
Thank you so much.
Okay.